On the occasion of World Sleep Day, we have with us Dr. Ushasi Banerjee, clinical psychologist at AMRI Hospitals, Mukundapur.
Hello, this is Dr.Ushasi Banerjee. I am a clinical psychologist and a mental health professional, and I am currently attached with the AMRI Hospitals, Mukundapur.
Hello ma'am, welcome to Indian Broadcast Network. Please tell us about the common sleep disorders and their symptoms.
Sleep disorder is when you are not getting sufficient amount of sleep, and it is basically a condition that impairs your sleep or prevents you from getting proper rest. That is the basic proper cause behind why a person sleeps, because it's basically biological. It's a basic need of the human body, and as a result it can cause daytime sleepiness and other symptoms like your work or your personal relationships can get hampered. So everyone can experience problems with sleep from time to time, and however, it's important to recognize and identify the symptoms if one is actually having a sleep disorder.
Lack of sleep is associated with poor mental health and many psychological conditions. Please share your thoughts about it.
Yes, because most of the psychiatric problems, be it physical or psychiatric, it's not necessary to discriminate, but if the physical condition is not in a proper state, then the body obviously has sleep deprivation. And similarly in mental health conditions like say depression or anxiety, when the body and mind are not in proper coalition with each other, and when the mind basically overthinks about various kinds of things, and night time is peak time when individuals keep thinking about or ruminating about various facts. So it basically affects the sleep time, and during the sleep time, before sleeping, I have seen patients are in a habit of going back to negative events and overthinking about them. So that actually causes sleep problems, and it interferes with the regular sleep-wake cycle. And in depression and in anxiety symptoms, to start with, early waking is also a common symptom, and people tend to be awake at the wee hours of the morning and feel low. So, and this overall sleep-wake problem and coupled with appetite problems and mental health issues these are basically the identifying factors for patients also, and also people tend to come to the clinicians seeking help for if not for their mental health issues, but goes up to the doctors when they are having regular sleep problems, and after that this interferes with their regular life. They feel tired and lethargic for the whole part of the day, and this interferes with their social occupational functioning as well.
Ma'am, please tell us about the consequences of sleep disorders and how can it be treated.
Okay, so as I told you earlier that it's very important to recognize that if one is having a sleep problem or not, or sleep disorder or not. So if one is regularly experiencing difficulty sleeping, a normal person basically needs 7 to 9 hours of sleep. So we say 8 hours of sleep is sufficient. But if one is not getting proper sleep, or even after sleeping, the person wakes up feeling tired and lethargic, or falls asleep doing vital tasks, like one is in office and then he starts dozing, or feeling extremely lethargic and is unable to work, then I think a clinician, a doctor needs to be contacted, and there are treatments for sleep disorders. There are various sleep disorders, like what are the kinds of sleep disorders? I don't know if I have mentioned before, but like insomnia is the most common form of sleep disorder people face, and then there is sleep apnea, then restless leg syndrome, narcolepsy, somnambulism. So these are the various common forms of sleep disorders we tend to see, and treatment is obviously available. We need to rule out certain organic factors. You see, sleep problems may happen due to neurological problems also. So Because if it is due to neurological issues, then you might be prescribed medicines for that. There are medicines available, and then one needs to maintain proper sleep hygiene for that. So, and then relaxation, meditation, yoga, lifestyle modification, these things also help in recovering from sleep disorders.
Ma'am, please tell us about the consequences of sleep disorders and how can it be treated?
Okay, so basically, patients then tend to come to us for having treatment, and this we have to basically tell them and guide them how to maintain a sleep hygiene, and this basically varies from person to person. But some of the general guidelines which can be said are that one needs to be active throughout the day, no matter what, and then be active. Regular exercising is necessary. Then, when one is have minimal, your food habits also need to be altered and modified if necessary. If one is having extremely spicy food or too much of food which is difficult for the stomach to digest at the late hours of night, then at night basically one should have minimal food quantity basically. So throughout the day when the body needs to work and be active, then the food is basically in proper quantity is needed. But at night when the body needs rest, so then having large amounts of food is basically considered unnecessary. So if there are any psychological conditions associated with sleep problems, there are some issues which one is unable to address himself, or if talking to relatives or family members are also not helping, then one might visit a professional like us, like a clinical psychologist, or you might need to undergo counseling where you can talk out your issues, or you need to learn proper ways of stress management. Then there are medications also, and then you need to maintain regular sleep schedule, having a proper place where you have minimal interference and noise and all that. Light should be minimized during when one is getting sleep. And another request we made to the patients is that try not to go to the bed, climb the bed when you are not sleepy. If necessary, you need to sit, wait for you to feel sleepy, and once you are feeling sleepy, then you go to the bed and then you try to sleep. But tossing and toiling on the bed without having the proper sleep is basically causes irritation to the patient also. And if one tries and forces oneself to fall asleep, then the sleep is obviously going to get altered. So you can engage yourself in some soft activities like listening to music or reading a book or something, like books or something. But yes, don't. And one more advice would be not to think and ruminate about negative things basically during the night, which is a very bad habit people gradually develop. So, and keeping oneself stress-free and in having a basically stress management issues also needs to be addressed here. So these things are some of the things I feel that can help one in getting proper sleep.
Thank you so much, ma'am, for your valuable time on Indian Broadcast Network and educating the masses about the steps to be taken towards prevention and management of sleep disorders and maintaining good mental health.